A root canal treatment includes removal of the decayed of the inner portion of your tooth or exposed and damaged nerve tissues of your tooth. We make sure that there is no remaining infection so as to prevent reinfection of the tooth. Depending upon the severity of the infection, we may plan 2 or more sittings for the same. A severely infected tooth will require multiple appointments to make sure that there is no infection and the entire infection has been taken out. Your dentist will make sure that you do not feel any pain in the tooth by anesthetizing the tooth. Then we would be cleaning the canals present in the root and crown with extremely thin files and taking out all the infection and pulp out of the tooth. Once the canals of the root are cleaned, we would be making sure that we give a dressing material of calcium hydroxide which would be placed inside the root canals for 2 to 3 days to initiate fast healing. In the next appointment, the dentist or we would be gauging if there is any chances of reinfection. If we see the canal has been completely freed of the infection, we would be then filling it with a biocompatible material known as gutta-percha. Gutta-percha would be filled in the root canals and then sealed off using a temporary filling material in the crown. If all is well and there is no chance of reinfection or pus remaining in the tooth, we then would be taking out the temporary material present in the crown and then filling it up with a permanent filling material. This material is usually a cement or a composite resin material. Next process would include the preparation of the tooth crown so as it is compatible for the cap to fit in. Rarely, in case of a mildly infected tooth, sometimes a root canal treatment is recommended. This is to ensure that the overall prognosis of the tooth is better and eventually for a very good overall oral health. In such cases, all the above mentioned 3 steps are done in a single sitting and the crown preparation is also done on the same day. In either of the cases, whereas a multiple sitting root canal treatment or a single sitting root canal, the last and the final step includes the preparation of your tooth crown or the cutting of the tooth crown, where your final cap would be placed. The final or the permanent cap would be delivered within the duration of 1 to 2 days depending upon the lab which the dentist is associated with. Remember, it is very important to have a permanent final cap on your tooth which is root canal treated. This is because after a root canal treatment, your tooth loses a lot of moisture and it gets dehydrated, which means it gets brittle, which is more prone to fracture. So basically, the cap acts like an helmet on your tooth to prevent any kind of external injuries and saves the root canal treated tooth. To know more about cap placements and their varieties, check out this video and do check out our website and download our app to know more information about oral health and eventually your overall health.